Hello, my name is Neil Patel, and my presentation is about new prevention products in the pipeline. First, we're going to discuss the biology of the HIV infection. The infection is transmitted from a donor's blood into the donor's genital tract through the transmission fluid into the recipient's genital tract, and then it ends up being in the recipient's blood. HIV encounters a genetic bottleneck during transmission, as you can see here in this image, and the results are the genetically homogeneous population of the virus is transmitted from person to person. Next, we will discuss the effect of HIV. HIV attacks a specific cell that is found in our immune system called CD4 helper cell, and it's also known as the T cell. When HIV destroys this cell, it becomes harder for the body to fight off other infections. For example, a cold could be a lot harder for your body to fight off with a low count of CD4 as it would be if you had a healthy count of CD4. And this is because the body has difficult responding to the new infections. Not only does HIV attack CD4 cells, but it also uses the cells to make more of the virus. HIV destroys the CD4 cells by using replication to create new copies of the virus, and this ultimately causes the CD4 cell to swell and eventually die. When the virus destroys a certain number of the CD4 cells and the CD4 count drops below 200, a person will progress from HIV infection to AIDS. However, it's more important that the advancements in HIV treatment have made it possible for many people with HIV to live a lot longer before developing AIDS. HIV is usually transmitted through blood, semen, vaginal fluid, and breast milk. Sex without a condom and sharing needles via a tattoo or piercing needles can result in the transmission of HIV. Through this presentation, we will discuss many different methods of how we could prevent the transfer of the disease HIV and prevent it from leading to AIDS. Antibody-mediated prevention (AMP). Can a passively infused monoclonal antibody prevent HIV infection in a high-risk adult? There were many studies conducted using the AMP study design, and usually it has to do with the dosage amount and how it is given to the patient. It's important to know if a lower dose is used, the more less of a safety issue it is towards the patients. The objective of this study, the antibody-mediated prevention study, was to see if VRC01 infusion is safe for patients and to develop a serum that is most effective in infected people. Next, we will discuss next-generation monoclonal antibodies. Knowledge of the structure of VRC01 was used to engineer a next-generation antibody with a 5 to 8-fold increased potency in vitro. A clonal relative of VRC01 has increased the neutralization potency, and 07 denotes sequential numbering when discovered. Optimized VRC01 CO7 protects against infection at lower plasma concentration, and it also has minimal reactivity. If the virus is targeted by multiple BNABs, then it will not be able to escape. Combinations of BNAbs and a tryptoceptic antibody can bind to virions and prevent HIV muscular infection and elicit antiviral responses in deeper tissue. It is hoped that the multi-target approach will prevent resistance breakthrough. HIV exhibits a genetic diversity and viral escape mechanisms. It is very important to consider using a combination approach. Like antiretroviral therapy, a combination of MABs may reduce the likelihood of viral escape and increase neutralization breadth. Combining many BNABs with specific antibodies against different epitopes into a single molecule has the potential to improve the efficiency of this treatment, simplify prevention and treatment regimens, streamline the regulatory pathway to a licensed drug. There are many products that are created for HIV prevention, and there are many that people don't know about. For example, there are oral pills, vaginal gel, vaginal ring, vaginal film, phosphate buffered saline, fast dissolving inserts, vaginal tablet, rectal gel, long-acting injectables, microarray patch, nanofiber, subcutaneous injections, diaphragms, and implants. There are many ways to prevent the virus from transmitting person to person, and not many people know about this. For example, a flexible silicone matrix ring called the dapivirine vaginal ring has found to be well tolerated, and it also reduces the incidence of HIV by 30%. Contraception is a choice. People are not forced to use contraception, and also not many people know of the different contraception options there are for them. Effectiveness does not drive all decision making, and perception of safety is always important. There are also many other factors when it comes to choosing the right contraception. Many are allergic to latex, many have different side effects for the pills and the gels. There's infusions, implants, injections, pill, vaginal ring, gels, inserts, vaginal film, lube, and douche. There are vigorous science studies that have been done to test these options, and it engages people on their choices. There are some that you can use every 6 months that have 6 month testing periods, and you use it once a month. There's pills which you would use for 6 months at a time, once a day, or you can do both. These are my references that I used for this presentation. Thank you and have a good night.